America has never had more ways to connect, yet millions of people move through daily life feeling invisible and alone. The crisis can hide inside a crowded train, a busy office, a family group chat, or a phone with 1,000 contacts. If you want clear breakdowns of the forces reshaping American life, subscribe to Faultline America. In 2023, the U.S. Surgeon General called loneliness and isolation an epidemic, and the warning was not just about hurt feelings, it was about public health, work, trust, and the social fabric of the country. Gallup reported in late 2024 that 20% of U.S. adults felt lonely for much of the previous day, an estimated 52 million people. The CDC uses a broader measure and says roughly 1 in 3 adults reports feeling lonely. Different surveys ask different questions, so those numbers are not interchangeable. But they point in the same direction. Disconnection is widespread. Loneliness is also not the same as being physically alone. Some people enjoy solitude. Loneliness is the painful gap between the connection you want and the connection you actually have. Someone can live alone and feel fine, or sit in a packed room and feel completely cut off. So, how did America get here? The easy answer is smartphones. But the real answer is a collision of technology, work, housing, family change, weakened institutions, and habits that removed human contact from ordinary life. Young Americans are a stark example. Analysis of federal time use data found that people ages 15 to 29 spent about 45% more time alone in 2023 than in 2010, rising from roughly 4 hours a day to 6. The pandemic accelerated the shift, but the trend had already started. Time alone is not automatically harmful, which is why researchers warn against turning one chart into a simple diagnosis. Still, fewer casual interactions can mean fewer chances to build the friendships that later become real support. Remote work shows the trade-off. It can provide flexibility, eliminate brutal commutes, and help workers with disabilities or family responsibilities. But for someone who lives alone, a day without an office can become a day without one face-to-face conversation. The same paradox exists online. A group chat can keep a family connected across 3 states. A video call can protect a friendship. But endless passive scrolling can create the feeling of being surrounded by other people's lives without actually being included. And if you're following where America's heading, hit subscribe, because this is where the conflict gets bigger. Some Americans see loneliness as a personal responsibility problem. Put down the phone, leave the house, make friends. Others argue that the country has demolished places where friendship once happened almost automatically. Neighborhood stores disappeared. Many communities were designed around cars instead of people. Public transit is limited in huge parts of the country. Libraries, parks, recreation centers, faith groups, unions, clubs, and local newspapers have faced pressure or decline in different places. The Surgeon General's advisory makes a structural argument. City design, transportation, schools, workplaces, technology platforms, and local institutions shape whether connection is easy or difficult. That does not erase personal responsibility. It means telling isolated people to try harder is incomplete advice when the surrounding system gives them nowhere to go. The crisis also looks different depending on who you are. Young adults, older adults, low-income Americans, immigrants, people living alone, and people facing disability or major life changes can face higher risk. In 2025, Gallup reported that 25% of U.S. men ages 15 to 34 felt lonely a lot of the previous day, compared with 18% nationally in the underlying 2023 and 2024 data. That does not prove one cause. Some point to weaker male friendships. Others point to economic insecurity, dating frustration, online culture, or changing expectations around masculinity. The honest answer is that several forces may be operating at once. The health stakes are why officials use crisis language. The Surgeon General's advisory says loneliness, social isolation are associated with higher risks of premature death, heart disease, stroke, depression, anxiety, and dementia. It compares the mortality risk of lacking social connection with smoking up to 15 cigarettes a day. That comparison describes population-level risk. It does not mean one lonely evening harms the body, like smoking a pack of cigarettes. But the broader message is serious. Relationships are part of the infrastructure that keeps people healthy. The political consequences may matter too. The advisory connects stronger social ties with community resilience, safety, economic prosperity, and representative government. When people stop trusting neighbors, institutions, and one another, disagreement becomes easier to turn into tribal conflict. That does not mean loneliness automatically creates extremism or polarization. It means a disconnected society may have fewer shock absorbers when fear, anger, or misinformation hits. So what actually helps? Not another app promising to optimize friendship. The most credible answers are less glamorous. Reliable public spaces, walkable neighborhoods, accessible transit, community programs, workplaces that create belonging, schools that teach relationship skills, and technology designed to support healthy interaction. At the personal level, the answer is concrete. Call someone, invite someone, join something, volunteer, show up repeatedly, and make room for conversations that are not efficient. The American loneliness crisis did not appear overnight. And it will not be solved by one program or one heroic act of self-improvement. It will be solved, if it is solved, through millions of small connections supported by institutions that make those connections possible. So here is the question. Is loneliness mainly a private problem Americans must solve for themselves, or evidence that the country has built a way of life that makes connection too hard? Subscribe to Faultline America, leave a like, and tell me in the comments where you think the breakdown really began.